I met Dr. Amen many years ago, more than a decade ago. I actually did a little field trip up to the Fairfield Clinic and asked him some very hard and difficult questions, and the answers I got were very meaningful and heartfelt and mainstream psychiatry. And that's when I was first starting to practice psychiatry. And so I referred a few patients who were difficult, say clinically or diagnostically, or I had treated with a few different either natural holistic approaches or medication approaches, and it wasn't working quite as we were hoping. So referred them for brain SPECT imaging, got the results back, went over the results with Dr. Amen, made some changes in the medications, and I've had excellent results referring to the Amen Clinic, getting that information. Actually, one of the things that I found to be the most helpful about brain SPECT, well, first of all, it gives me tremendous clinical hard data, objective information about how the patient's brain is actually functioning. So that just helps me making diagnostic decisions and treatment decisions. But it also seems to be extremely helpful to have an image that you can actually show the patient and let them know either about themselves or about their child that this is the area of the brain that is overly active or underactive. This, in all likelihood, is what's causing these sets of symptoms, and this is how we're going to address it. So it really seems to help both parents of kids as well as patients themselves to understand this is not just in their head, so to speak, but it's a real medical, physiological issue, problem that's going on in the brain. We can see it, and now we can address it. So those two things probably have been the most helpful and beneficial for me in referring to the Amen clinics. A recent case of midlife or about 40, 50-year-old individual, has issues of substance abuse in past history, attention deficit issues, some depression. Same scenario, had tried various medications with him. Things weren't working quite as well as I had anticipated, and or we were going in a different direction with treatment, and I just wanted confirmation and to really see what was going on in his brain, and he was in full agreement. So I sent him and got the brain imaging results back, and that session, going over those results with him, were just as I had mentioned, very beneficial. It was really helpful for him, to see exactly what's going on, in his brain. And then we've taken some medication approaches and based on the SPECT scan results, and I'm getting excellent results. So, we're continuing to tweak the medication, and he's very sensitive to different side effects and such, so we've had to really, tweak the doses. But anyway, that's just one example of a case that was confusing diagnostically, not responding to treatment as I had anticipated, sent for the scan, got the results back, great results, and going over that with the patient, and then the treatment options that we're taking now are helping. The clinical history is obviously our best tool and essential. However, to have an additional physiological tool or procedure that's available that can show us exactly what is happening from a blood flow standpoint in the brain just makes perfect sense to me. And I guess I can understand those who would want to see the organ that we're treating, how it's functioning. I don't quite understand those who wouldn't want to see, a functional imaging study of the brain's physiology and, like I was saying, the organ that we're treating. So and from a clinical standpoint, I've had such outstanding results with sending patients, getting the results back, helping me decide what to do, going over those results with the patients, and then seeing good clinical outcomes based on the scan results, in addition to the clinical history. So I'm a very strong advocate for looking at the organ that we're treating, getting that physiological information. It's a very helpful tool that we have available and that all clinicians and mental health professionals have available to see what is happening with their patient's brain, and then to be able to address it more clinically, medically informed, more definitively. There have been cases that I've referred where the entire treatment approach has changed and altered based on the scan results. So I can think of one in particular. This was a child patient who we initially thought had a lot of attention deficit issues. Was very restless and fidgety and moving around quite a bit, had a lot of trouble paying attention, focusing, concentrating. So initially, before they came to me, they were treated with stimulant medications. Things got worse. When they came to me, I tried a non-stimulant approach to treating the ADD, but got not good results. So sent them to the Amen Clinic, got the brain SPECT done, found out from the study that there was a significant amount of anxiety occurring, shown by overactivity in the basal ganglia region. So completely changed my approach, went to anti-anxiety, natural holistic approaches as well as medications, and had a much better clinical outcome. So it turned out that this patient's ability to focus, concentrate, pay attention, and inability to do so was much more determined by anxiety rather than attention deficit disorder per se.